going to be a really good point to find for finding our neutral, our line of the pelvis. Now, do you guys remember the trick of finding the greater trochanter?
Internal rotate?
Yeah, so internally rotate for me, and then come back, and do it again. So she pops out pretty good right there. Okay, go ahead and relax. Okay, so you can see where her greater trochanter is. It's not all the way down here, right? We're gonna be up this direction, okay? Are you okay? I'm pressing, mine get tender, so sorry if I like over press. Okay, so I want you to bend your knee up. Okay, then you see what her back does? Flattens a little bit. And then if I keep an eye on her ASIs here, if I reach underneath, I can find her PSIS right on it. I'm right on it right there. But you can kind of run, if you just kind of come in and run your fingers along from the ASIS and down. Like obviously I'm not going to be able to reach her PSIS here, but we're going to go midline where she's here and down from her ASIS. Just kind of find this angle. We can find her her iliac crest too, and at the point of that, that's also a good point to be aiming for our stable side. Okay, but if I keep my fingers here right along her crest, I want you to bring your knee all the way up to your chest. See what my fingers did? Go back down and do it again. See, she really pulls. She tilts posteriorly. You guys all see that? Mm-hmm. Okay, and go down. Good. So I want to find that line between where she's tilting. She's going to have to tilt a little bit, but then we don't want to continue with that and be gaining because she's posteriorly tilting. So I'll take her and bring her up and find where that movement stops. So about right there is where I want to measure her. And if you're close enough to see that, you guys can come closer. I'm not going to bite anybody. But I hope you're seeing what I'm talking about, because this is a problem with every semester with students, is finding this midline and telling me when the pelvis is tilting. So get comfortable with palpating and finding the pelvis, okay? Okay. So my points, her greater trochanter again, she's right here. I'm going to run this right through the midline of her pelvis, and this will go up to her lateral epicondyle. So I'm going to have you lift that leg up. Okay. I'm pinching on something. You just resist it first. Okay. So I'm going to give her about 100 on that. Now, if I wanted to see how much she could go and take it all the way, we do want, it's kind of, you can look at this in two ways, like with the scapula involved, right? That creates the full complex of the shoulder, and so we were allowing that to move some. So if we allow this to move just to see what kind of motion she has, we could see how far she could get that leg up too using both. But if you're really aiming at just the hip joint, we want to watch that the pelvis doesn't tip too much posteriorly. Is that making sense to everyone? Okay. Okay. Turn over. I'll find her iliac crest again, her PSIS. So I'll probably go about midline right here of her pelvis. And then finding her greater trochanter right there. It's actually easier because no matter the size of anyone's behind, it's going to push tissue out as you lay on it, right? And so it exposes it even easier not having soft tissue around it when they're on their stomach. Okay. Now this one gets hard do just active. Okay, so straighten that leg. And then go ahead and raise it for me. So if I was just to check her active range of motion. Okay, go ahead and go down. She'd be 8. Right? Now I would want, if I wanted to help her from here, it's coming, okay, you can bend your knee up just a little bit. Well, probably not that much. So what I sometimes will do is kind of do this and watch, see what her pelvis does. It wants to go up and tilt. Okay? So we have to find that relaxed position where that's not happening. Are you okay? But she's now 19 versus active, which was 8. So she gained 10 more just by me helping her. Alright. So this one's a hard one. I know it's a hard one. You could always have someone help too. If you wanted to get it in this position, have someone come hold the leg and you help them decide what position to be in. But I'll show you